This is your Surgical ABCs trivia quiz. Can you get all 26 correct? I'll give you the clue, you name the diagnosis or term. Let's go. Acute abdominal pain starting around the umbilicus and migrating to the right iliac fossa. Appendicitis, right upper quadrant pain caused by a gallstone temporarily obstructing the cystic duct. Biliary colic, the clinical triad of right upper quadrant pain, jaundice, and fever. Cholangitis, acquired mucosal herniations through the colonic wall, often at sites of vessel entry. Diverticulosis, the surgical removal of the inner lining of an artery to treat carotid stenosis. Endarterectomy, the limb-saving procedure required when compartment pressures exceed 30 mm mercury. Fasciotomy, black necrotic tissue resulting from a total loss of arterial supply. Gangrene, the anatomical region bounded by the rectus sheath, inguinal ligament, and inferior epigastric artery. Hesselbach's triangle, abdominal pain, diarrhea, and hypertension. Ischemic colitis, the primary site of absorption for the majority of nutrients in the small bowel. Jejunum, heavy-duty locking hemostatic clamps. Kocher forceps, the gold standard surgical approach for elective cholecystectomy. Laparoscopy, obstruction of the common hepatic duct due to a stone impacted in the cystic duct. Mirizi syndrome, the presence of calculi within the renal pelvis or collecting system. Nephrolithiasis, pseudo-obstruction causing massive colonic distension without a physical blockage. Ogilvie syndrome, acute epigastric pain radiating to the back with a rise in serum amylase or lipase. Pancreatitis, a collection of pus between the tonsillar capsule and the pharyngeal constrictor muscle. Quinsy, the release of myoglobin into the bloodstream following prolonged limb compression. Rhabdomyolysis, the definitive treatment for bleeding esophageal varices or spider veins. Sclerotherapy, muffled heart sounds, raised JVP, and hypertension. Tamponade, an open sore on the skin or mucous membrane. Ulceration, the coffee bean sign on a plain abdominal X-ray. Volvulus, a procedure involving the removal of the pancreatic head, duodenum, and gallbladder. Whipple procedure, the use of a biological graft such as a porcine heart valve in a human recipient. Xenograft, the color of plain catgut suture material. Yellow, a gastrin-secreting neuroendocrine tumor causing refractory peptic ulceration. Zollinger-Ellison syndrome. How many did you get right? If you want to test your knowledge more and correct those surgical blind spots, check out the link to start your knowledge audit. Let's master surgery together.